Welcome back to Jersey Matters. I'm Larry Menti. Trying to make certain that foster homes are a last resort for children in New Jersey who have been abused or neglected. That's the goal of our next guest, Mary Coogan, who is Vice President with the Advocates for Children of New Jersey. Thank you so much for joining us. I appreciate it.
Thanks for having me.
So when you say you're trying to make certain they don't have to go to foster homes, where do they go?
So the hope is that kids can stay in their homes, and that if the parent is having a problem, we can put the services in the home. And that's the goal of a new federal law, Family First Prevention Services Act, which New Jersey is going to try to implement. And the idea, I guess I'll back up. So kids who might be abused or neglected, there's different levels. When it's most serious, obviously you may have to remove the child from the home, but sometimes the parent is just struggling, having a problem, and needs help. And so if you take the child out of the home, you're actually imposing further trauma on the child. So we want to keep the kids in home, safely though, and we want to put the services in the home to help the parent get over whatever the problem it is.
When you say put the services in the home, do you have a person there?
You might. Or sometimes it might be that the parent has some type of an alcohol or drug problem, and so you might have to bring help into the home to take care of the child. Maybe you ask a relative to move into the home while the parent goes to their 30-day program. Or you then have a parent then going to outpatient. But at least now you haven't had to move the child, uproot them from their school, from their friends, from their environment.
So part of this is trying to get relatives involved in the process?
Yes.
That's probably easier said than done.
It can be, right? So in New Jersey right now, we have, in terms of foster care placements, probably a third of our foster care placements are relatives, and that's a great thing. But I know the current commissioner, Commissioner Norbert Byer, would like to get that up to 80%, because generally kids know their relatives. Now, sometimes they may have to go with a relative that they don't know very well, because obviously the relative still has to be screened. You still have to make sure they have space in their home and that they can safely provide for the child. But most times kids know their relatives. So if they have to go live with Aunt Sue or Uncle Mark, that would be a very easy transition for a child as opposed to going to a stranger.
Are relatives always willing?
No. And it's not so much that they're not willing. Sometimes relatives have their own problems, right? They may not have space for the child. They may have a child who's sick. But sometimes the relative has already tried to help the parent, and they're very frustrated with the parent, and they've sort of said, I'm done. And then it can be difficult to re-engage them, because your goal, even if you put the child in foster care, is to then reunify the child with the parent. And so if you have a relative who's really been upset with a mom, once they then are asked to take the child, they may just think they're sort of saving the child, and then they want nothing to do with the parent. And under law, the Division of Child Protection and Permanency is supposed to work to get the child back home.
So no matter what, you're dealing with the parent. No matter if it's a foster home,
Yes.
it's a relative, you're dealing with the parent.
Yes.
But because of family dynamics, sometimes the relative wants nothing to do with the parent.
Correct.
Because they've been upset all along with the situation, right?
Right, and
is that pretty much it?
They may have been the one out of their own frustration who called the division on the parent to begin with to report them.
Does it cost the same amount of money if it's a relative that takes rather than going to a foster home?
Yes. In New Jersey now, we license relatives and non-relatives, and we pay them a monthly board rate to take care of the child. And you don't get a lesser amount just because you're a relative. And I think that's totally appropriate. I think sometimes if the relative has to contact the division on the parent doesn't want their child to go to the relative, because they're mad at the relative as well. Sometimes relatives have also had a prior history with the division, and so they can't be licensed, and that can be a problem.
Sounds like there's a lot of problems.
There are a lot of problems.
Is it working?
I think there are things that have definitely improved. New Jersey was sued years ago, and we are now under a federal court settlement. The good thing is that brought a tremendous amount of financial resources to the state in terms of the state agency, in terms of they have doubled their budget over the years, so they brought in a lot of professionals to help train staff. They have really tried to model, best practices. So I think there has been a lot of improvement. There's been a lot more services, but I think they still struggle because it's hard. Some of these families are very difficult to deal with.
Let's back up for a second.
Okay.
How do you get involved? Where do you come in? Because it's a state agency that's running this.
Correct. And we're not a state agency.
And you're not a state agency,
No.
but they welcome you?
Sometimes. Sometimes we work with them, and in fact, right now we are collaborating with the division. There's been other times where we're the ones who are raising awareness about a problem that we see within the agency, and they're not very happy with us. So it depends on what's going on. We do understand that this is a very difficult business. We do understand that they need resources, so we will tend to advocate for the budget resources that the department needs. But there have definitely been times where we have been opposed to a practice that they want to implement, or we don't think they're handling things in a correct manner.
Who funds you?
We are an independent nonprofit, so we're funded. We have a small endowment, and we get a lot of foundation dollars, individual contributions. People who want to donate to us, we welcome those donations as well.
But in all of these cases, in all of the cases with foster care, you're somehow involved?
Well, not all of them. So we do collect data on foster care placements. We get that data from the State Department, and we report that in our Kids Count publication. We monitor that data. We monitor and we will comment on laws that might impact this case type, regulations that the department is proposing. We will comment on those. But also, personally, I take what we call case advocacy calls. So let's say you are trying to get a nephew out of foster care and you don't understand. It's just, foreign to you because of the jargon. You could call me and I would explain to you what the process is.
What's that number?
That number, 973-643-3876. And Mary Coogan, yes, Mary Coogan and I get the call. So what I do, I might take, several hundred of those calls a year. And it's through those calls that I kind of understand where the problem issues are, and then we try to help those individual people, but then that's how we know things that are working and not working.
So sometimes you get involved in individual cases.
Yes.
For the most part, you're looking at its
On
entirety.
the outside.
Yeah.
Yes.
And also, you mentioned a moment ago that you are looking for funding. You're fighting for funding for the agency and for the children, and that's why this census that's coming up is so important.
So yes. So the census, as you know, the census occurs every 10 years. So the next census is 2020. There is a tremendous, probably $23 billion comes to New Jersey to fund all sorts of programs, and it's federal dollars, but it's based on the census count. So if we don't have an accurate count, New Jersey stands to lose these federal dollars, or some of these federal dollars. Right now, there's what they call hard to count populations. We are focused, my office, AC&J, on young children, and that's because in the last census, it's been determined that probably 28% of the children ages 5 and under were not counted.
And how much money would that be?
I don't know.
It's millions,
but
though.
Yes, it definitely is millions of dollars. But I mean, total. So things like Medicaid, which funds our health insurance program. So 20% of people in New Jersey, both children and adults, are enrolled in New Jersey Family Care, which is our state public health insurance program. And a lot of that is Medicaid dollars. So if we don't have a proper census count and the state doesn't get all the federal Medicaid dollars, they will have to come up with state dollars to make up the difference.
So what do? You just get the message out that please take part in this census because it's going to benefit you?
We will do that in general terms, but we're also working with other people to identify these, what we would call hard to count populations. So people who do not speak English as a primary language, people who are in urban areas where you might have a lot of immigrant population that they're afraid, even though the child is born in New Jersey, so they're a citizen, they might have relatives in the home who are not here.
And they're afraid that it's a federal form and somebody's going to come after them, which
Correct.
You have to explain to them that's not going to happen.
Right. So yesterday we had a forum. We had somebody there from the census, and what he was saying is they're going to try to let people fill out the census on the internet this year. And so one of the things they're looking to do is if you have what we call a trusted messenger, so it might be a faith-based, a church, a synagogue, a temple, it could be a child care agency, it could be another community agency where maybe they would actually set up a laptop and people could come in and fill out the census form there. And I forget how many languages. He said there's at least 12 languages they'll have, and that people could then fill it out online. So you'll get a card in the mail.
It sounds like it could be ripe with fraud.
Well, it could be, but you still have you're going to get a card and you're going to get a number. So you have to log in with your household number.
Okay. I got it.
Sorry.
If there's something really important you need to say because we're running out of time,
okay.
But I appreciate
thank you so much for your
coming in. Mary Coogan is the Vice President with the Advocates for Children of New Jersey. Thank you so much for coming in.
Thank you.
Jersey Matters continues right after this. Still to come when we return, a new restaurant that has revitalized an entire neighborhood. We'll tell you where it is when Jersey Matters continues.